So getting into the causative factors or the factors that are basically responsible for the development of this particular condition that is known as hydrocephalus is very important. So we'd be going into the details of the causative factors, or which is also known as the etiological factors, in case of hydrocephalus. Now, there is a very interesting mnemonic which is basically going to be quite helpful for you and in remembering basically what are the etiological factors. Now, it can be a brain tumor. Big head is basically the mnemonic that we're following over here. So the B over here is basically standing for brain tumor. And then we can have the infectious states. For instance, we can have a lot of congenital conditions, a lot of malformations. For instance, we'd be studying the Dandy-Walker malformation and the Arnold-Chiari malformation. And all of these malformations are basically going to give rise to an infectious state. Then we can have the acquired infections as well from the environment, of course, and then some of the neonatal infections, that is due to some factors that were basically responsible for a neonatal infection. Either it can be bacterial, viral, or the fungal infections that can occur in a neonate. For instance, it can be the chlamydial infection, and that is basically giving way to the development of hydrocephalus in the newborn or in the neonate. Then the G over here is basically standing for the gliosis. Now, gliosis is basically a tumorous condition, a neoplastic condition, and obviously, as the name is even indicating, it's a benign kind of a tumor over here. Relating to the glial formation, but obviously it's an acquired aqueductal state over here. When we'd be going through the details of the anatomy of the ventricles, we'd be knowing the fact that the third and the fourth ventricle is basically being communicated by the aqueduct of Sylvius over here. This is basically a narrow pathway, and whenever there is the formation of a glioma or the gliosis that can occur, it's basically an ependymal tumor that is occurring over here. It can cause the stenosis of this pathway. And this narrowing is basically going to build up a back pressure on the third ventricle as well as on the lateral ventricles. And this condition is going to be known as the gliosis. And again, it is one of the very important etiological factor over here. Then moving on, we have the H over here in the big head, the mnemonic that we have to remember over here along with the hydrocephalus patients. Hemorrhage is one of the etiological factors. It can be either a subarachnoid hemorrhage occurring at the subarachnoidal space. You must be remembering the fact that we have these three protective layers, namely the dura mater, we have the pia mater, and then we have the arachnoid mater. The CSF is basically flowing in the subarachnoidal space, and whenever this subarachnoidal space is going to be filled up with the blood in cases of hemorrhage, which can basically occur due to any kind of a traumatic condition, head trauma, which is basically occurring and is basically giving way to the subarachnoid hemorrhage, it can again be one of the causative factors for the development of the hydrocephalic condition or an increased intracranial pressure, of course. Then we have intracerebral hemorrhages. So hemorrhages which basically occur inside the brain. So even it can be these spaces inside the brain or the cerebral cortices itself. They can even cause an increase in the intracranial pressure, and they can mimic the conditions of the hydrocephalus as well over here. Then we have the elongation of the fourth ventricle, which can obviously be a congenital condition in a patient as well. It can be a malformation, and again, it is going to cause an elevated intracranial pressure over here. Moving on, we have the aqueductal stenosis. So we went through this fact that there is a communicating duct between the third and the fourth ventricle, which is known as the aqueduct of Sylvius. And any kind of a condition, even apart from gliosis that we just studied over here, apart from this condition of gliosis, it can be even some sort of other tumors. For instance, it can be the cerebellar tumors, which are basically putting a pressure on the aqueduct of the Sylvius, and they're basically causing the stenosis of the aqueduct of Sylvius over here. So it can be one of the mechanisms for the raising up of the intracranial pressure in the third ventricle or either in the lateral ventricles. Then finally, we have a very important and a very notorious malformation, which is known as the Dandy-Walker malformation. So it's one of the conditions which basically arises, and it is basically characterized by three basic phenomena. First of all, we have an abnormality in the posterior cranial fossa development. So we have these three fossas starting from interiorly. We have the interior, then we have the middle, and then we have the posterior cranial fossa. So whenever there is a maldevelopment or a malformation of the posterior cranial fossa and is basically leading to some sort of malformations of the cerebellum, and along with that, the floor of the fourth ventricle is also affected in cases of the Dandy-Walker malformation. So whenever this happens, basically, this condition is also going to give rise to the stenosis of the aqueductal duct, and which in turn is basically going to rise the intracranial pressure. So this is one of the mechanisms for the development of hydrocephalus over here. Now, flowcharts basically make things a lot easier for the students. So over here, we're going to just focus on the major conditions that are basically causing the increase in the intracranial pressure or the bulging or the swelling of the ventricles over here. So we went through the basic characteristics of the Dandy-Walker syndrome. It's basically a malformation, and which is basically a congenital condition. It's going to be a congenital condition, not an acquired condition in the individuals. And usually the neonates have that particular characteristic phenomena that they're going to suffer from. The swelling of the head is going to be a very important sign and symptom over here. Sunset eyes, they're going to be present in these particular patients. So the congenital hydrocephalus is usually due to the malformations that occur in the individuals, and mainly it can be even apart from the malformations such as the Dandy-Walker malformation, it can even arise due to some sort of infectious states over here. So basically, we have the intrauterine infections, which can basically give rise to the congenital hydrocephalus, and these infections are namely, they can be the rubella. It's basically a viral infection. Then we can have the cytomegalovirus. It's again an infection that basically travels from the mother to the neonate. So these are some of the pathways that the infections can basically travel to the neonate. And then we can have toxoplasmosis as one of the major causative factors in the intrauterine infections. Then trauma. It can be a trauma that occurred during the process of the birth, during the delivery, and it can basically lead to the infections to travel from the mother to the newborn as well. It can be one of the major pathways. Trauma can even occur in the adulthood, and it can be obviously the head trauma that basically give rise to this intracranial pressure rises in the individuals. The subarachnoid hemorrhages over here are very important. And then we have the intracranial hemorrhages that can also occur in the cerebral hemispheres. And then we have the intraventricular hemorrhages. So hemorrhages can even take place inside the ventricles. Mainly we have the lateral, the third, and then we have the fourth ventricle. So we have a paired lateral ventricles where the hemorrhages can take place. We have the third ventricle and we have the fourth ventricle where all of these hemorrhages can take place. And they again are going to give rise to the bulging, the swelling, or any kind of a malformation that can take place inside the ventricles and inside the normal flow of the CSF that is basically occurring, that is basically interrupted due to this hemorrhage that is taking place. And that is basically going to lead towards an increase or the bulging of the ventricles over here. Then we have the congenital malformations. Now, the congenital malformations, we went through the fact that we have the Arnold-Chiari malformation and we have the Dandy-Walker malformation, and that can basically give rise to this particular phenomena of hydrocephalus. Now, over here, we have the Arnold-Chiari malformation, and it's one of the acquired hydrocephalus. Acquired hydrocephalus is basically, it can occur due to the arteriovenous malformations. So we must know the fact that the absorption of the CSF is again very important, and this absorption takes place at the suprasagittal sinuses through the arachnoid granulations. So whenever there is a problem with this arteriovenous play that is present over there at the sagittal sinuses, this malformation can give rise to the development of hydrocephalus, and the normal absorption is basically interrupted in this particular case. And that is again going to give rise to the intracranial hemorrhages that are taking place. A ruptured aneurysm can again cause hemorrhages in the cerebral hemispheres, as well as it can give rise to the hemorrhages in the ventricles as well, or in the obviously in the subarachnoid spaces. Then the posterior cranial fossa tumors are again very important, and namely we have, for instance, we have the medulloblastomas, which are again responsible for the development of increased intracranial pressures. Astrocytomas are also very importantly placed over here. Ependymomas are one of the classical examples. Basically, the ependymal cells are responsible for the secretion of the CSF, and they are basically lining the ventricles. Ependymal cells are lining the ventricles, and this is again very important to remember, because any kind of a tumorous condition, if it occurs with the ependymal cells, it can basically result in the increased production of the CSF, and which is again going to basically give rise to a condition in which there is an increased intracranial pressure. So this can be one of the mechanisms for the development of the a hydrocephalic condition in the patient. Then we have the post-intraventricular hemorrhages. They can also occur in the patients. And then we have the pyogenic meningitis, obviously any kind of infections. Specifically, the bacterial meningitis is one of the conditions in which the patient is suffering from an increased intracranial pressure, but it's obviously a reversible condition. And basically, the prognosis is very good in patients of the pyogenic meningitis.